It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So we're having a lot of inquiries where families say, should my loved one have a tracheostomy? Should they not have a tracheostomy? And it's so important that you ask the right questions when you have a loved one in intensive care. The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights. And they don't know how to manage doctors and nurses in intensive care. A much better question to ask when the ICU team is asking you, well, do you want a tracheostomy for your loved one or not, is how can they avoid the tracheostomy? But you actually need to ask that question from day one. So here's what happens in ICU, especially for patients that are on ventilators with a breathing tube and they're in an induced coma. From that day onwards, there needs to be a plan how to get your loved one off the ventilator as quickly as possible. And that is often easier said than done. You know, there can be many obstacles around that, but it nevertheless must be the goal. Because, you know, really a ventilator and a breathing tube can only be a temporary measure to preserve life, to cure your loved one and get them off the ventilator as quickly as possible. Because if you can't get them off the ventilator as quickly as possible, you know, then the question is what's next? And then the question that is coming up inevitably is often, tracheostomy or no tracheostomy. Okay, so there must be a plan from day one how to get your critically ill loved one off the ventilator. Now, case in point. So when families come to us and they say, you know, should my loved one have a tracheostomy or not? Then I tend to ask them, you know, well, when did you find out about tracheostomy? Well, I didn't even know a tracheostomy was a thing until 2 days ago. That's when they first started talking to me about it. You know, again, that's another sign that you need to do your research from day one, because if you're not doing your research, you're losing critical time to get your loved one off the ventilator as quickly as possible and avoid the tracheostomy, right? A better question to ask is how to wean a critically ill patient off the ventilator and the breathing tube. And I have done an article about that and, you know, recorded a video about that specific topic. And that is the better question to ask, but that is a question you need to ask from day one, not when the ICU team is thinking about a tracheostomy. And especially in the US, you know, if your loved one ends up with a tracheostomy, then they often end up in LTAC. And I've made countless videos about LTAC, why your loved one shouldn't go to LTAC in the US, right? So it is so important that from day one, that when your loved one is, God forbid, going into ICU, that you are doing your research, you know what to look for, you know what questions to ask, you know, and bear in mind when someone is on a ventilator with a breathing tube in an induced coma, they're deconditioning every day matters. You know, your loved one gets weaker every day they're on a ventilator. So don't wait for the ICU team to bring up a tracheostomy. Start asking, what is your plan to wean my loved one off the ventilator and avoid a tracheostomy? That is a much better question to ask, right? And if, God forbid, your loved one has a tracheostomy and is still ventilator dependent, once again, you know, the question is, how can you wean off my loved one off the ventilator and the tracheostomy? What is your plan? Those are the most important questions to ask, and look for the answers, right? Look for the answers and get a second opinion. You know, I have worked in intensive care and critical care for nearly 25 years in 3 different countries, where I also worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And that's also why we created a membership for families of critically ill patients in intensive care. And you can get access to the membership if you go to intensivecarehotline.com, if you click on the membership link, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have access to 21 ebooks and 21 videos that are specifically written and recorded for families of critically ill patients in intensive care, making sure you make informed decisions, you have peace of mind, control, power, and influence, right? I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I talk to doctors and nurses directly. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one in intensive care. Once again, so that you can make informed decisions, have peace of mind, control, power, and influence. You will see that I will open your eyes and that I will make sure your loved one gets best care and treatment, right? We also offer medical record reviews in real time so that you can get a second opinion in real time, helping you once again to make informed decisions, have peace of mind, control, power, and influence. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. I also represent you in family meetings with intensive care teams, or I'll be there with you over the phone or on a video conference, once again, making sure that your loved one gets best care and treatment so that you get the outcomes that you would like for your loved one. Now, all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.